Welcome to our audience participation video on carpal tunnel syndrome in real time. So let's first have a look at what we're going to need for this. First, I'll explain what the syndrome is all about, so you have a rough idea and know why you should follow the instructions to the letter. Then we'll do a rolling massage, and for this, we'll be needing the mini massage ball and the mini foam roller. In case you don't have our set yet, take a ball of similar size or a rolling pin of roughly this dimension, and if what you have is too hard, wrap it up in something soft like a towel. And then we're going to show you two of the most important stretching exercises. Now, first, let's talk about what carpal tunnel syndrome actually is. There's pain, a tingling sensation right here. There's a small band going across your wrist that makes up this carpal tunnel, and it is assumed that for some reasons this small band becomes too tight and presses on the nerve, compromising its function. And so we ask the logical question, why should this small band shrink inwards and reduce the space underneath? I'll explain this effect slightly differently in a moment. Whenever we build up too much tension, for example, when we write on a keyboard, use the PC mouse a lot, or use our thumbs for texting, doing all these shortening movements when you play the piano, then most of the time our hand movements involve bending, and when we show our body this bending movement over and over again, it will get used to this and bend even more. And then there's a force connection running on the outside from the extensor muscle across the wrist to the flexor muscle, and if there is excessive tension, the tendons start to swell up, everything becoming thicker, and as a consequence, there's not enough room anymore. But the solution is not to change this little band here, to even cut it. The solution is to normalize everything beneath this band that has become too thick, to bring that swelling down, and we're going to achieve that with our rolling massage and our exercises. And if you feel better afterwards, then this is proof positive that it is not this little band that makes you suffer, but it's the swollen muscles and tendons. Okay? Ina, please, let's start. And I'll take our tools, and let's begin on the floor. You at home can do this at a table, sit in front of it. We'll do the exercise on the floor since we don't have a table. We'll start on this spot by putting some circling pressure on it. Place your hand on it like this and look for the most tender spots. Put your wrist on it and move around, and also move into the palm of your hand. Everything is crammed in there due to lack of space, and we want to get the accumulated fluids moving. Put the other hand on top to increase the pressure. Our massage balls are perfect for that. If you only have a hard ball at home or a wooden ball, you need to be very careful because this area is very tender. But with a softer ball, you can apply more pressure and get the fluids in motion. And we roll slowly to dissolve the matted fascia and cover the entire area where you have problems and look for tender spots, centimeter by centimeter. And as soon as you notice certain spots that are very tender and painful, stay on them, apply more pressure, and you'll notice after a minute of rolling how the sensitivity to pressure of these spots is dialing down because the system is slowly coming back to life, because the fluids are being exchanged again, the pain receptors are switched on, and everything becomes more relaxed. Ina here is rolling very slowly, very carefully. You at home, simply follow her and roll over this entire area here Look for tensed up spots and visualize how you're moving the fluids in there. So, I guess you've covered the area, probably found some tender spots, right? So I'd say, let's put away the ball and do the following. Take the mini foam roller. Ina, please place your hand on it. And now, put the other hand on top of it and use it to increase the pressure. And then slowly roll forward. Slowly forward. Yes, don't stop. Keep rolling, but slowly, millimeter by millimeter, towards your wrist. Spread the pressure equally across the entire area. And now, press this wave of fluid along towards your wrist. Now the arm has to come down. Bend your elbow downwards, and that allows you to move forward. And if you feel you have to rotate your arm, move your elbow out more so that you lie on the roller like this, because we need to cover this area here. Move sideways a bit to change the angle. You could use your other hand for support. And now we're in the area where everything is tight. And here you squeeze out all the waste towards the elbow, along the lower arm, then change hand position and continue with high pressure towards the elbow. Press. As you could see, Ina is slowly moving along, millimeter by millimeter, keeping the pressure up. And that's exactly how it should be, because if you relieve the pressure, the fluid will flow back. And that's why we have to keep up the pressure, continuing on towards the elbow. The other hand is of great help, so you won't need your right arm to build up enough pressure, but you simply lean with the left hand on it to push it harder into the roller. Push it hard enough into the roller. Good. And lower your body if you feel it makes it easier for you to apply pressure. It's easier at a table because the table is higher, and that helps in adjusting the angles. Okay, and now let's do it all over again, but now on the back of your arm. Let's start here again, and now place the back of your hand on it. It's the same idea here as well. The other hand applies pressure, and we're rolling forward millimeter by millimeter. Keep going. And you at home, just do this exercise at the same pace. Ina's doing a great job here. Not too fast, not too slow. And you at home, visualize how small these openings for pushing the fluids through are. And then you have a feeling for how slowly you have to roll to give the fluids a chance to move along with the rolling. So you won't simply roll over the fluids, because that would diminish the effect. Great, Ina. And your hand is right on top of it. And that also helps squeeze out the fluids here. It could be possible that the tingling sensation in your fingers becomes stronger, but that's not a problem at all, because afterwards everything will be relaxed again and your nerve will be freed up again, or as much as it was before, maybe even a bit more, because the rolling alone is enough since fluids have been moved. Great, keep on rolling. Change hand positions towards your elbow. Whenever you make a cake and roll out the dough with your rolling pin, This might be a mental image for you now, even if it's slightly different. You flatten the dough to make it as thin as possible. And we do the same here. We bring the fluid level down and push it forward like a wave to squeeze it out. And as soon as we've arrived at the elbow, we're done. And we can put the roller away and immediately go to our first exercise. With Ina here, it's the right side. So Ina, please get down on all fours. You can do that at a table, so you just stand in front of it. And at the office, you could use your desk for a quick exercise. And now turn the hand backwards. With Ina, it's the right one. So it points towards your knee, the right one, and align your thumb with the other fingers. Align your thumb with the other fingers. Great. And now, it depends on how much of a stretch you already feel. And then you apply pressure on the base of your hand, the one that stays on the floor, by moving your shoulders back. And the more you move back, the more you stretch this area open. That means you push as you move your shoulders back. And please take your time. Take a lot of time because it's getting tighter there for all your tendons and muscles. Very tight because this rather acute angle squeezes everything together. But it also stretches everything long, and we take advantage of that fact and wait for it to heal, and then we move back a bit more and increase this very slowly. It's barely noticeable. Stay a little shy of 10 on your personal pain scale, maybe 9.5. Let me remind you, 8 means it clearly starts to hurt. 9.5 means the pain is even more pronounced, but not enough to prevent you from breathing calmly or decouple mentally and physically from the pain. As soon as you do that, it's a 10, and you have to dial it back a bit. And you could see, looking at it from the side, the angle is more acute. I think we're almost done with the 2.5 minutes. And now, let's change up the exercise. But we stay where we are and only change the position. And we go further back. Back even more until the wrist goes up, until your fingers are flat on the floor, but your palm goes up too. From the floor or the table, doesn't matter. You could see how the fingers are bent backwards. And now, Ina, you can also pull on your thumb. Can you do that? Do it from the other side so that the people at home can see. And now Ina is taking her thumb and pulling, but carefully, pulling on her thumb. And you can feel the stretch here. It's a great relief for your texting thumb. And do that for 2.5 minutes. Ina even pulls up her thumb a little. And you could see how the angle becomes smaller here. And if a pain or tingling is triggered right here, where you felt it before, caused by the carpal tunnel syndrome, now we pull everything long in here, everything that has been swollen. You create a lot of tension now, and you might think, is this dangerous? Not in the least. The moment it's over, it goes back to normal, and everything is freed up. And you realize, oh, I don't think I need surgery. Okay? I think we're about done here. So we leave this position slowly and carefully because it's a lot of stress. Leave slowly and normalized everything. Don't be concerned. If it hurts quite a bit, that's normal. Shake it out, loosen up, everything will be fine and feel great. So, let's get up. If you've liked our video, give us a thumbs up and subscribe to our channel. For another video on this topic, click on the upper right-hand corner. We'll see you soon.